Let's discuss infective endocarditis. So, what is infective endocarditis? It is inflammation of the endocardial surfaces of the heart, typically involving one and more than one heart valve. So, it is basically inflammatory process which involve the heart valves, and the most commonly affected valve is mitral valve. Aortic valve is also affected by the infective endocarditis, but it is less common than the mitral valve. Mitral valve is most commonly affected by the infective endocarditis. Okay, now the tricuspid involvement is mostly associated with IV drug users. Okay, so cause of the infective endocarditis is bacteria and fungi, but bacteria is most commonly involved in causing the infective endocarditis. Okay, so the infective endocarditis can be due to multiple bacterias. It can be due to staph epidermidis, and staph epidermidis most commonly involves the prostatic valves. Okay, and the genito-urinary and gastrointestinal procedure is associated with enterococcus bacteria, which can lead to the infective endocarditis. So gastrointestinal and gastro-urinary procedure has association with infective endocarditis because enterococcus is involved in these procedure, which can lead to infective endocarditis. While the colon cancer also can be associated with infective endocarditis because it has involvement of staphylococcus galoleticus bacteria, which can lead to infective endocarditis. While the gram-negative organism which can cause the infective endocarditis are Haysick organism, Haysick group of organism. H for Haemophilus, okay, Haemophilus bacteria. A for aggregate bacter bacteria. It is also known as the actinobacillus bacteria. C for cardiobacterium. E for echinella, and K for candela. Okay, so these organism, Haysick group of organism, cause the gram-negative infective endocarditis, while the culture negative infective endocarditis is caused by Coxiella and Bartonella. Okay, Bartonella. Okay, the IV drug user is associated with infective endocarditis, which is caused by the Staph aureus. It can be caused by Pseudomonas bacteria, or it can cause the fungal endocarditis, in which the Candida fungi is involved. Okay, so this is the bacterial and the fungi causes of the infective endocarditis. So staph epidermidis, prostatic valves, enterococcus, gastrointestinal and genito-urinary procedure, staphylococcus galoleticus, colon cancer, Haysick group of organism, the gram-negative infective endocarditis, Coxiella and Bartonella, culture negative, and Staph aureus, Pseudomonas, and Candida, which is fungi. Staph aureus and Pseudomonas are bacteria, while the Candida is fungi. It is associated with IV drug user infective endocarditis. Okay, so these are the bacteria. Now it can be due to of two forms. Infective endocarditis can be acute, which lead to large destructive vegetations on previously normal valves. The acute form is rapid in onset, and it is caused by Staph aureus, while the second form is subacute endocarditis. It lead to smaller vegetation on congenitally abnormal or disease valves. Okay, and it can be due to the dental procedure. It can be sequelae of dental procedure. It is gradual in onset. Um, okay, the acute one is rapid in onset, while the subacute is gradual in onset, and it is most commonly caused by strep viridans group of bacteria. Okay, so these are the two forms of the infective endocarditis, acute and subacute. Okay, now if we talk about the clinical features, so the most common presentation of the infective endocarditis is fever. It is the most common clinical presentation, and more than 38 more than 38 degree C temperature. Okay, fever. So fever is the most common clinical presentation. It can also cause or present as new murmur. It can present as vascular phenomena, which can be septic embolism, petechiae, splinter hemorrhages, Janvi lesion. So what is splinter hemorrhages? It is basically the linear hemorrhagic lesions on the nail bed. I will show you the picture later. So splinter hemorrhage is the linear hemorrhagic lesion on the nail bed, while the Janvi lesion are present on palms and soles, and they are painless flat erythematous spots or lesion. Okay, so Janvi lesion and splinter hemorrhages occurs in on nail bed, while the Janvi lesion on palms and soles, and these two are vascular phenomena of the infective endocarditis, while the immunological phenomena in the infective endocarditis can be due to immune complex deposition, and it can lead to glomerulonephritis, osler nodes. Osler nodes is basically the painful lesion, violet color lesion on the fingers or toes. Okay, so osler nodes are painful, while the Janvi lesion are painless. Roth spots. What is Roth spot? It is basically the retinal hemorrhagic lesions. Okay, retinal hemorrhagic lesions. So this is the Roth spots, osler nodes, and glomerulonephritis. It is due to immunological phenomena of the infective endocarditis. Now, coming to the pathophysiology of the infective endocarditis, so the first step in the pathophysiology is endothelial injury. It can be either due to previous damaged valve or congenitally abnormal valves. So when there is endothelial injury, it can lead to formation of vegetation. Okay, and vegetation are located on the heart valve, and it contains the platelets, fibrin, and microbes. It can be bacteria or the fungi, but most commonly the microbe will be bacteria. Okay, so the endothelial injury can lead to formation of vegetations on heart valves. Okay, and these vegetation then lead to valve regurgitation, septic embolism, immunological phenomena, vascular phenomena. Okay, so if there is embolism to the if there is left side endocarditis, then there will be embolism to the systemic circulation. But if there is right sided endocarditis, then the pulmonary embolism will be to the pulmonary circulation. Okay, so this is about the pathophysiology. Now, how we will diagnose the infective endocarditis? There is this clinical criteria which is called Duke criteria. So Duke criteria has two types of scores: minor criteria and major criteria. So as we discuss the clinical features of the infective endocarditis, these all are included in the minor criteria of the due criteria of the infective endocarditis. While the major criteria include the multiple blood cultures and 2D echocardiography. 2D echocardiography can be like transthoracic or transesophageal echocardiography. Okay, so the multiple blood cultures echocardiography forms the major criteria, while the clinical features like fever, new murmur, vascular phenomena, okay, and immunological phenomena, it makes the minor criteria. So according to due criteria, if there is, how we will diagnose the infective endocarditis. So if there is two major criteria, then it means this is infective endocarditis. But if there is one major criteria and three minor criteria, then it can also shows us the infective endocarditis. And 5 minor criteria is also the infective endocarditis. So due criteria is the clinical criteria for diagnosing the infective endocarditis. So 2 major criteria, infective endocarditis. 1 major and 3 minor criteria, infective endocarditis, and 5 minor criteria, infective endocarditis. Okay, so this is about the infective endocarditis. Now okay, so this is the splinter hemorrhage. Okay, this is the splinter hemorrhage on the nail bed. It occurs on the nail bed, and it is basically the linear hemorrhagic lesion. Okay, linear hemorrhagic lesion. You can see these lesion, these are genuine lesion, and it is the flat painless erythematous lesion on the palms or soles, while these lesion oscular nodes are present on the fingers or toes, and it is the lumpy violet lesion, and it is painful on the fingers on the or on the toes, while the raw spots, it is the retinal hemorrhagic lesions. Okay, retinal hemorrhagic lesion. Okay, so these are raw spots. Now, okay, so this shows the linear hemorrhagic lesions on the nail beds. So basically it is the splinter hemorrhages. Okay, now this is the picture of the pathophysiology or pathogenesis of the infective endocarditis. So it starts from the endothelium injury or endothelial injury. Okay, so when there is endothelial injury, okay, so it lead to vegetation formation. Okay, formation of vegetation on heart walls, and the vegetation is basically the thrombus with the infiltration of the microbes. So the vegetation will contain the platelets, fibrin, monocyte, red blood cell, neutrophil, lymphocytes, and the microbe, which is most commonly the bacteria, but it can be fungi. Okay, so this is the vegetation, the pathogenesis of the infective endocarditis.